Imagine waking up one morning with a scratchy throat, a runny nose, mild fatigue, maybe a slight cough, and thinking it's just another cold, only to discover that a new virus is quietly spreading across your city, your country, and potentially the globe, leaving thousands of people sick for longer than usual, hospitals seeing more patients with flu-like symptoms that test negative for influenza and COVID, and suddenly the words Adenovirus Outbreak are popping up in news articles, social media, and even in conversations at your workplace or school, and you start asking yourself questions like, what is adenovirus? Is it dangerous? Should I panic? Can I protect myself and my family? Because although adenoviruses have been around for decades, this particular strain circulating now in the USA and UK is showing patterns of spread and persistence that make it a trending topic in public health discussions. And unlike the seasonal flu, which typically peaks predictably and for which vaccines exist, adenovirus has no widespread vaccination program for the general population. And while it is not a new virus biologically, the current outbreak has caught attention because of the unusually high number of reported cases, especially among children, young adults, and even some otherwise healthy adults who are experiencing longer-lasting symptoms that sometimes interfere with work, school, and daily activities. And to understand why adenovirus is getting so much attention, it's important to know that adenoviruses are a large family of viruses that can infect multiple systems in the body, why respiratory, gastrointestinal, and sometimes even the eyes, leading to a range of symptoms from mild cold-like illness to conjunctivitis, diarrhea, and in rare cases, more severe complications in immunocompromised individuals. And unlike COVID or influenza, adenoviruses are generally self-limiting, but their ability to spread rapidly in crowded environments such as schools, dormitories, nursing homes, and offices makes them a public health concern, particularly because they can mimic flu-like symptoms, leading people to think they have caught the flu or even COVID, delaying proper diagnosis and potentially causing confusion. And the spread is facilitated through respiratory droplets, close contact, and contaminated surfaces, meaning simple hygiene measures, hand washing, mask use in high-risk settings, disinfecting surfaces remain crucial tools to prevent transmission, and despite the media hype, the vast majority of adenovirus infections are mild and resolve on their own within 1 to 3 weeks. Yet what makes the current situation noteworthy is the sheer volume of cases being reported, prompting local and national health authorities in the USA and UK to issue guidance, track patterns, and alert clinicians to be vigilant for more severe presentations, especially in children under 5, older adults, and people with weakened immune systems. And as a patient or caregiver, it is natural to feel anxious when you hear about a spreading virus, but it's equally important to remain calm, understand the facts, and take measured steps to protect yourself and your loved ones without giving in to fear or misinformation. Because unlike emerging zoonotic viruses like H5N1, adenovirus is already well characterized, and while it may be uncomfortable, it is rarely life-threatening in healthy individuals. And medical professionals emphasize that supportive care, hydration, rest, over-the-counter symptom relief, and monitoring for any worsening signs is typically all that is needed, yet it's also essential to recognize when to seek medical attention, such as in cases of high fever, persistent shortness of breath, dehydration, severe diarrhea, or eye infections that do not improve, because early intervention can prevent complications in vulnerable populations. And as we discuss adenovirus in the context of the USA and UK, we should also consider the broader public health perspective, where viral surveillance, case reporting, and hygiene education play a pivotal role in controlling outbreaks and in schools, daycare centers, and workplaces. Simple measures like staying home when sick, frequent hand washing, avoiding sharing personal items, and cleaning commonly touched surfaces can dramatically reduce transmission. And while vaccines exist for specific adenovirus types used in military settings, for the general public, there are currently no approved vaccines, which is why the emphasis remains on prevention, early recognition of symptoms, and supportive care. And understanding adenovirus also involves dispelling myths that can cause unnecessary panic, such as the idea that everyone exposed will get severely ill, or that the virus is comparable to C. Ovid in terms of lethality, because scientific data clearly shows that adenovirus infections are typically mild, with complications being relatively rare, yet because it is highly contagious, awareness and precaution are important. And this is where MedLogic's mission comes into play, to provide evidence-based, clear, and calm explanations that help you navigate health risks without fear-mongering. Because knowledge empowers informed decisions, and when families understand how adenovirus spreads, what symptoms to watch for, and how to reduce risk, they can take action that protects themselves and their community, which is more effective than panic or misinformation. And in addition to hygiene measures, people should be mindful of maintaining overall health, including adequate sleep, nutrition, exercise, and managing stress, because a strong immune system can help the body fight off infections more effectively, and parents and caregivers should pay particular attention to children who may be more susceptible to certain symptoms like gastrointestinal upset or prolonged fatigue, and in rare cases, hospitalization may be needed for supportive care. But these are exceptions rather than the rule. And another important point for viewers is to stay informed via reputable sources such as the Centers for Disease Control and Prevention (CDC) in the USA, the UK Health Security Agency (UK-HSA), and peer-reviewed medical literature, because accurate information helps counteract rumors circulating on social media and news outlets. And if you are a teacher, healthcare worker, or someone FIM, equally in contact with children or vulnerable adults, extra precautions such as mask use, surface disinfection, and symptom screening can further reduce transmission. And from a global perspective, adenovirus is an example of how even common viruses can surge unexpectedly, reminding us that vigilance, public health infrastructure, and individual responsibility all work together to keep communities healthy. And while adenovirus does not currently pose the same pandemic threat as novel emerging pathogens, its capacity to disrupt daily life, schools, workplaces, and healthcare resources should not be underestimated. And as scientists continue to monitor the situation, ongoing research into adenovirus biology, transmission, and potential therapeutics may provide additional tools in the future. But until then, understanding the virus, recognizing symptoms, and practicing preventive measures remain the best strategies for individuals and families. And finally, while it is normal to feel concerned when hearing news of a spreading virus, the facts remain. Adenovirus infections are mostly mild, supportive care is effective, complications are rare, and informed awareness can prevent unnecessary panic. So by knowing what adenovirus is, how it spreads, what symptoms to monitor, when to seek medical help, and how to protect yourself and others, you are already taking the most important steps towards safety. And if you found this explanation helpful and want to stay updated on emerging viruses, public health news, and evidence-based medical guidance in the USA and UK, make sure to subscribe to MedLogic, because this channel exists to provide clear, trustworthy, and calm guidance to help you protect your health with confidence.